So the first question today is, as if you were talking to a patient, explain what IV gadolinium is used for an MRI. What are the major concerns or potential complications from IV contrast administration, and how do we minimize these risks? Finally, how would you respond if the patient refused the contrast? IV gadolinium is used in clinical MRI to enhance the appearance of pathology such as cancer, neoplasm infections, autoimmune conditions, and inflammation. Potential complications from IV contrast are impaired kidney function, severe allergic reaction, and complication with the IV. We minimize this by calculating the GFE and CR in the patient's blood to see if we will have any complications prior. For an allergic reaction, we will recommend a pre-medication protocol of corticosteroids and antihistamines. Complications with the IV, we scrub the IV hubs with an alcoholic pad for 15 seconds prior to connecting syringes or injector lines, helping maintain a sterile, clean fluid path. If the patient refuses contrast, I will document their choices. Continue the study to be performed without contrast and have them return for follow-up as needed. And it says, talk us through the three main scan planes used in MRI. What are they called, and what sections do they divide the body into? Why does an MRI protocol include a sequence and multiple plane scans? I put the three main scan planes in MRI are axial, coronal, and sagittal planes. The axial plane divides the body into sections from superior to inferior. The coronal plane divides the body from anterior to posterior. The sagittal plane divides the body into sections from left to right. MRI protocol includes sequencing in multiple scan planes because it is run sequence by sequence with the coverage and angulation. Explain your understanding of a protocol in MRI. What are they and why are they used? But a protocol in MRI is basically the setting of which part of the body you're going to be looking at. They are used to organize the MRI images taken during the exam. Why is it important to take notes at clinicals, especially when it comes to protocols? It is important to take notes at clinicals because there are several protocols and diagnosis needed to use them, which radiologists want specific sequence and how different each tech likes to plan sequences. And it's too much information to hold in our brain.